Representative Murphy is recognized. We have a proposed committee substitute before us. Representative Murphy moves that we do. All in favor will say aye. Opposed, no. The proposed committee substitute is properly before us. Representative Murphy.
Thank you, Mr. Chairman. Good morning, ladies and gentlemen. I have the great honor today of presenting the STOP Act again, House Bill 243. We spoke about it a couple weeks ago in committee, and since then we are now on version 16, and we have had a great amount of stakeholder input, constituent input into making this bill what I believe is going to be a landmark legislation for our state, and as I've been approached actually by legislators from across the country, possibly a national model. We have been blessed by having the fact that 15 additional members of the Senate have co-sponsored the bill, and 72 members of the House have also co-sponsored this bill. We have endorsements from the North Carolina Sheriff's Association, North Carolina Association of Chiefs of Police, the North Carolina Conference of District Attorneys, the Medical Board, the Metro Mayors Association, the Addiction Professionals of North Carolina, the North Carolina Harm Reduction Coalition, Healing Transitions, Burke Recovery, Coastal Horizon Center, Incorporated, amongst the folks who have endorsed this bill. I would like to, again, since we have made what I believe are significant improvements to the bill, to run through it again for everyone. Specifically, I want to bring out the fact that when we're talking about scheduled drugs, we had revised this. At first it was Schedule 2 to 5. And just to review what scheduled drugs mean, they're scheduled from 1 to 5. 1 are the most addictive substances, and those are prohibited by law, things like marijuana, LSD, etc. And 5 are the least addictive substances. We have limited the scope of this bill to Schedule 2 and Schedule 3. There's also some difference in the federal scheduling compared to the state scheduling, and that's going to be taken up in another bill. But we're also excluding what they call 2N and 3N medications. These are medications like Ritalin, Adderall for ADHD, et cetera, and also 3N, which are testosterone type of steroids. Again, these are not pathway drugs to opioid use. So briefly, in the interest of time, I'm going to try to run through the bill again. First, we'll be extending the standing orders for naloxone, Narcan, which is the anti-opioid drug, to community health centers, local health departments, law enforcement, and substance abuse organizations. It gives them immunity for the dispensers or the prescriber, for anyone who administers the drug. The drug is an innocuous drug and is literally, and I've seen this personally, a life-saving drug. Also, this bill strengthens language that requires supervising physicians to review plans with nurse practitioners and PAs when a controlled substance is to exceed 30 days, specifically for periods of 90 days. This is not necessarily something that needs to be done in person, but can be done via phone, Skype, etc. This helps strengthen our hold on some of these pain clinics. E-prescribing, this is when you can click on the computer and send a prescription in, is going to be phased in, where it is not a 100% requirement, but something that is the top level that people are reaching towards. We want to try to get out of the prescription pad business for opioids. There will be special circumstances when this will be needed. Prescription pads are not going to go away, but we're trying to get everybody to get prescription pads as much as we can out of the business of prescribing opioids. When we limit circumstances where the medications are to be used, and let me be very explicit about this because there's been some concern about this, we are not talking about pain medications for chronic conditions. We are not talking about them with hospice conditions, cancer conditions, palliative care conditions. We are talking about pain medication in the acute setting. At present, the bill says that we're going to limit the prescription for acute pain for 5 days. We're also going to limit the prescribing of the medications for post-surgical pain to 7 days. This gives some prescribers some leeway into the number of pills prescribed, but it puts a definite limit on the number of days that can be prescribed. This also requires hospice and palliative care organizations who deal with people who require pain medication towards their final days, final months, or even final years, to educate the family and educate the patient about the proper disposal of these targeted substances. Hospice is not allowed to take any medications from the home. Those are the personal, private property of the patient. But to educate the family on drop-off methods, on how we can get rid of the patient, these pain medications, get them out of medicine cabinets at home. We're also going to strengthen the controlled substance reporting system and requires that dispensers query the system for any scheduled drug that they dispense. And finally, and then there will be fines if they are not working with CSRS. We've reduced some of those fines. CSRS has no desire whatsoever to be a fining organization. We're just trying to get everybody involved, from prescribing to administering to dispensing these drugs, to have some skin in the game. DHHS will get information each year and give this information to the prescriber and their prospective licensing boards about their prescribing habits if someone is outside of what is deemed to be a standard care practice. Every practitioner is required to review the CSRS system if there is a 90-day prescription and every 90 days, to make sure that they're not getting medications from somewhere else and to make sure that they're not doctor shopping. There are rules to alert the dispensers that they are required to query the CSRS system prior to giving medications. For example, if somebody comes in from out of county, out of state, and they come in with a prescription for a narcotic, there are just certain type of red flags that the pharmacist or dispenser should see, that if this person could be prone to prescribing to fraudulent opioids. There will not be any civil or other liability. There will be immunity for a dispenser if that is not done. We're again trying to raise the bar for people who have all contacts with these opioids. As far as funding the CSRS system, there used to be a fee in there. That has been removed. This is going to be hopefully monies that will be appropriated by the General Assembly. There will be an annual report by DHHS to the Joint Legislative Oversight Committee on Health and Human Services and all the appropriate licensing boards to the activity of what's gone on with the system for the past year. And finally, in the original bill, there was $20 million for community substance abuse programs, and that was thought to be best to be pulled out of the bill and dealt with specifically in the appropriations arena. So with that said, I'm happy to have any questions. There will be 2 amendments to the bill that I would like to submit, and if the chair pleases, we could take those up now, or we could wait.
Representative Murphy is recognized to present Amendment 243 ATY 8, Version 2.
Thank you, Mr. Chairman. This is basically just a language amendment to tighten up the language for postoperative pain relief and just make sure that it's a 7-day supply of the targeted control substance. And we can go ahead and vote on that if you like, and then I'll move to the other one.
Members, questions on the amendment? If not, the question before the committee is the passage of Amendment H243 ATY 8, Version 2. Those in favor will signify by saying aye. Aye. All opposed will say no. The ayes have it. The amendment passes. Representative Murphy is recognized for Amendment H243 ATY 9, Version 2.
Thank you, Mr. Chairman. This is just further clarification of the enactment date, February 1st, beginning on February of 2019. Shall just say that the department will report to the committees that I spoke about previously.
Questions from the committee? If not, the question before the committee is the passage of Amendment H243 ATY 9, Version 2. All those in favor will say aye. Aye. All opposed will say no. The ayes have it. The amendment passes, and we are back on the bill. Ladies and gentlemen, if you have any questions or comments, the chair would just ask that, if possible, you make them very, very brief. I would like to get to the second bill today, if possible. We've got a big agenda in health, as you know, and crossover looms. So with that said, questions from the committee, comments, Representative Boswell.
Thank you, Chairman. I have a question about the e-scripts. I work in a very small rural practice, and we do not have e-script. Will that affect us in any way?
Thank you for the question. What we have done is, and I'm fully recognizing that not every practice does e-scribing, is we have pushed out the enactment date for 3 years. And a lot of folks, a lot of dentists, veterinarians, et cetera, do not e-scribe at the present date, and this is trying to give them time to try to work and get some functionality. There are systems that deal just specifically with e-scribing that you don't have to have a full EHR, and it gives folks time to get that up and running.
Further discussion, further debate. Representative Ball.
Thank you, Mr. Chair. I wanted to inquire if there was consideration to the letter that those of us on the committee received from the Academy of Integrative Pain Management as to the amendments that they suggested that we consider.
Thank you for that question. I reviewed that. I just got first yesterday, and being as I honestly, this was on the 16th version of the bill, I did not feel it necessarily needed anything different in this particular issue of this.
Further questions? If not, Representative Murphy, would you like to make the motion?
I would be
I'm
honored.
sorry, is there a question? I'm sorry, Representative Yarborough.
Thank you. I hadn't really noticed this veterinarian part before. Has there been any response from the veterinarians against being included in this?
No, sir, I have not heard one word from them. The rationale for this, and again, we're trying to throw as wide a net as possible for anybody who prescribes these drugs, is although it is a relatively rare occurrence, there are people who have been known to seek medications for their pets and then take those and distribute them, opioids specifically.
Seeing no further questions on the committee, Representative Adcock.
Just one quick question, Mr. Chair, and thank you very much. I understand the rationale for taking the $20 million out of the bill and dealing with it with appropriations. And since we're fortunate enough to have the appropriations chair sitting here, I just wondered what his sense was that we'll be able to see that $20 million come back because we know its importance.
Representative Dollar, would you yield to the question?
I yield, Mr. Chairman.
Representative Dollar is recognized.
Well, first of all, I believe this is a very high priority. It's certainly an incredibly high priority for the House, and I believe it's a priority for the General Assembly from all the conversations that I've been having. What you do technically, and it's the same as a bill that we'll have on the floor today, we know what the cost will be, and when although we cannot appropriate now, you cannot appropriate ahead of the main budget, we will have to account for that when the budget comes through the House. We'll have line items that will account for this and any other bill that we do. We usually only have about 2 or 3 that we handle in this fashion, things that are very important that we want to go ahead and move the policy ahead of the budget, and then the budget will have to account for that, which we will do.
Follow-up.
Follow-up,
I just
Representative
wanted to
Adcock.
thank you for doing that for those in the audience who don't know that process, so they know that this money is, everybody considers this a priority, and we expect we'll see that money.
That's correct. Thank you.
Any further questions from the committee? Representative Murphy, would you like to be recognized to make a motion favorable to the PCS as amended and rolled into a new PCS, unfavorable to the original bill with a serial referral to appropriations?
I would. I could not have said that better.
Thank you, Representative Murphy. Members, you've heard the motion. All those in favor will signify by saying aye.
Aye.
All opposed will say no. The ayes have it, and the PCS is given a favorable report, rolled into a new PCS, and will be referred to appropriations.